I don't feel fine. I don't feel well, but I don't even know like how to put finger on it. When is it that we really have to say, wait, no, it's not fine. I really need to seek some sort of help. When would that be?
It's a great question. I think in our culture, unless you're like bleeding out, you're fine.
Let's just get right into it. Okay. So Dr. Jang Cho, thank you for being here. I really appreciate you making the time. Even though this is your third time on the podcast. Yay! Would you briefly introduce yourself?
Okay, well, thank you, Min, for inviting me again and again.
Love it.
So my name is Dr. Jang Cho. I'm a child and adult psychiatrist. I do have my own practice, but also my special interest is in working with Asian American families. So my practice actually, a little less than a half of my patients are Asian American families. And I say families because we tend to treat children with families. And so that's been my passion. In addition to that, I've written book chapters for child psychiatry, for Asian American mental health. I've worked with different organizations in supporting Asian American children.
You know, as a part of the mental health series that I'm doing, today I wanted to go over with you how to maybe break down the barriers that we have. We always talk about, you know, the Asian American AAPI community. We don't seek help until something actually happens, like a crisis breakout, right? And then we don't even know how to get help, or we've never talked about our problems, especially mental health issues. So I wanted to talk to you about like what do we do? Like how do we get over this, right? I'm sure you see among your patients or even in a social circle, when you ask somebody, oh, how are you? Our automatic answer is, oh, fine. Everything's great. And I wonder sometimes, I don't feel fine. I don't feel well, but I don't even know like how to put finger on it. When is it that we really have to say, wait, no, it's not fine. I really need to seek some sort of help. When would that be?
It's a great question. I like the fact that you're starting with that, right? Because I think I'm so in it that sometimes I forget that that's where people grapple with. To answer your question about the, to add to your comment about like I'm fine. So my go-to start of my sessions usually for each patient is like, how are you, right? And most people will say like, I'm good. And I go, really, how are you today? And then they kind of open up. Obviously in our sessions they know, but so it is right. Knee-jerk response is like, I'm fine, right? But what is fine? Right. And I think the definition of what is fine is very broad. And I think in our culture, unless you're like bleeding out, you're fine. Right. To get to the point about, well, at what point am I not fine and I need to think about help? I think about the other opposite end. You know, a lot of people think about, well, if I'm miserable or if I'm thinking about like, oh, I don't want to live. And those are the extremes, right? And even then, sometimes it's hard for people to, especially for Korean Americans, I think is difficult for us to say, well, that's just, isn't that how most people live? Like, you know, like, like, oh, I wish I could be dead. In English, it's a little different, but when you say that in Korean, it's like very normal saying in some ways. Right?
차라리 죽고 싶어 or something like that, right?
Right. Yeah. So it's a different connotation in some ways, right? And that's very cultural difference. So I think that to me, obviously, as a psychiatrist, if someone says those things or thinks about those things, that's very serious, and I take it very seriously. And that's like another extreme. But I think a lot of people don't think about the opposite end of it, where am I actually enjoying things in life? Right? So it's not about like me feeling miserable or feeling like dreadful, but am I actually enjoying parts of my life? parts of the days. Like, you don't have to be happy and joyful all day, every day, which who does, right? Maybe young children. But it's about, like, the saying, like, do I stop and smell the flowers once in a while? And then when I do, and if I do I feel joy? And I think if you, like, stop and think about it, then there's your answer. Like, if the things that used to matter to you, the things that made you happy are no longer there, then that's when you think about, well, I need some help. When you are losing interest in things that used to give you joy, I think that's very important. So for adults, right, if you're losing interest in socializing, if you're someone who takes really joy in kind of going out with friends or talking on the phone with your friends, especially for women, right, or the hobbies that you used to like are no longer fun. Like, if you're losing bits and pieces of your interest, so then we start thinking, well, something is going on.
Something is going on.
Mhm.
Isn't that every day though? Like, do we really find like, I mean, it sounds like, okay, like, can we at that point, oh, am I depressed? Am I going through depression? But if I say that to like other folks, I think people would say, well, that's every day for me.
Yes.
Mm,
Yeah. So, I think part of it is the culture, right? Like, you just push through. There's so many things that you need to do, a lot of obligations, and those things become kind of the priority. But if you, I've mentioned kids, but if you look at children, they're not in a hurry, right? Like, they stop and look at things, and little things make them laugh out loud. When do we lose that quality, right? And so I think that it's important to, well, with or without depression, it's important to do that in your life, right? Like, kind of, I always say I collect little bright things in life, and that those little bright little things, tiny little things, add up to my happiness. And that could be like, my dog sitting in my deck and just looking at me, and I think I find it funny. Or cherry blossom happening out the window, or like funny jokes that happen. Like, for example, this morning my daughter said, I'm gonna make a joke for you. And she said, do you know why psychiatrists don't go to the bathroom? And I'm like, we don't. And I was like, why? And she goes, because pee is silent. Right? So, like, silly jokes, right?
Yeah.
But it was funny. So those little tiny moments, right? But what if you just go through, oh, that's such a lame joke, right? So that's the slight difference. And you have to train your brain to actually enjoy those moments, right? So that's a kind of a lifelong goal for people that are living this modern day where everything's really, really busy, really everything goes fast, and you miss out on those things because everything else seems so important.
Yeah.
Right?
Yeah.
But there is a point where even if you tried, you don't feel anything. And maybe that's the time where you have to look back and be like, something is going on.
Yeah. Yeah. So I think what I'm hearing you say is that when we don't notice the little stuff, when we forget to find some joy in anything in life, that's when we have to stop and think, am I okay? I think you're so right. We are so used to getting things done, busy, and like all the functions and responsibilities and the behaviors, we forget that life, you're supposed to enjoy life. You're supposed to find joy in life.
Yeah.
When you said that, I'm like, what? What joy?
Yeah.
But yeah, I see what you mean. Hmm. Hmm. Isn't that so sad?
Oh,
We think this is
things
so
get
normal.
lost. Yeah,
Yeah,
things get
things get
lost.
lost,
Yeah.
definitely. Wow. So, I'm thinking about moms particularly. I remember when I was a younger mom, when my kids were younger, once someone asked me, "Oh, what do you like to do? What are your hobbies?" I'm like, blank in my mind. I'm like, what are you talking about? What hobby? I don't know. Like literally I'm not even exaggerating. That was a like mindset where I was, during those times.
When I say little things, and I've been there, like people, like, even before children, people are like,
Mm,
"What's your hobby?" And I really think about it, and I was like,
mm.
eating or like
That's
breathing,
good.
right? And but I it's great to have a hobby,
Mm,
but I'm not even talking about hobbies, right? Like
mm,
it's just the mundane things in life that
mm,
can be fun or little fun, right? So,
mm, mm,
like I think it's about also like mm, I can never find the right word in English, but
mm,
you,
mm, mm,
right? And
mm,
so, like this morning, I made my cup of coffee, and I was like,
mm,
oh, today was much better than yesterday.
mm,
That moment. That's all I'm
mm.
asking, right?
I
But
see.
you have to cognitively train yourself,
Mm, mm,
and when you're dealing with a toddler or little babies, like you might just chug it, right? But
mm,
even the moment where I'm like, well, my kid is
mm,
9, so now I can sit down and have a sip of coffee. Like,
mhm,
wow, that's actually really great. So
mm,
that cognitive change, I think,
mhm,
is
mm,
what's helpful. And when you don't, or when you can't do that,
mm,
even when you try
mm,
it, I
mm.
think that's when you're like, I need some help to find that
Yeah,
back.
yeah, yeah. It is important to notice that and remember that you need to find it back.
Mm-hmm.
So it's a practice, it's a mindfulness, it's something that doesn't really happen automatically, but it's something that we
Yes.
need to work on,
Mm-hmm.
a catch, right? Why do we have such hard time getting help, emotionally, mental help, especially?
Oh, this was something that I've been thinking about too lately.
Mm,
But I think part of it is, um, well, there's multiple things going on, but part of it is like our culture where you should be able to do this on your own,
mm,
right? Right. If we're not taught that uh, mental health is something that you can get help with, it's like,
mm,
or you're just not. You're if you do, then you're weak, right? Like it's your will should be able to do it,
mm,
and then there's a stigma about therapy, psychology, psychiatry, right? That's only for crazy people,
mm,
right? So
right.
that's number two. And then I think more and more, especially for Asian Americans and Korean Americans in the United States, I think the access to care, especially for mental health, the barriers are really high. Um, having being more knowledgeable about how to get help is really difficult. The road to get the help that you need is very tortuous, and most people don't know how to navigate that. And
Yeah,
that's not
yeah.
just for Asian Americans, it's
Mm,
for most Americans, unfortunately, at this
mm,
point. But I think
mhm.
with the language barrier too and stigma barrier, I think it becomes double and triple layered.
Yeah, yeah. Yeah, it's so true. You know, people in the community sometimes as fellow mom or older mom, they ask me about therapy and And there's such a big block, like a barrier for them. One, the stigma. And two is like, "Ooh, do I really need it at this point? Maybe it'll get better." And the third one is, I can't afford the cost of therapy because it's expensive. It's mostly out of pocket. So let's first talk about how do we get help? Like, where do we go? How do we seek for help? If I said, "Oh, I notice, oh, I'm not finding joy. I'm noticing that." What do I do?
Well, the easiest and the most accessible is to go to your primary care doctor, and or your for your kids' pediatricians,
Right.
right? And for women, sometimes OBGYN is the primary care doctor, and we as physicians we are trained to screen you, and also a lot of the primary care doctors and pediatricians and even OBGYNs for postpartum, they do have referral base. Right. And if there is a need for medication, sometimes they are able to start them. So that is the number one, like easiest access in terms of kind of getting the help. And you mentioned the financial part of it. And so most of those physicians do take insurance, and so that would be covered. So I think that is the easiest start. So that's number one. Number two is if you're looking for strictly for therapy, there are some websites that are very specific for therapists. Psychology Today is going to be able to kind of get you to therapists in your area, and you can kind of filter through kind of, whether they take the insurance or not and things like that. So that's number two. And post-COVID, also, this is something that was good thing that came out of anti-Asian hate movement was that there are multiple, but there are two really representative websites that actually have names and search engine for Asian American therapists in the United States, and you can actually search through geographical and language therapists who are in your area, who speak your own language and things like that. And so that's a start as well. So that would be actually really helpful looking for therapists.
So first talk to your family doctor or your primary care for referral, and they're able to, you mean, start like a medication immediately if you need
So
it.
they can
If
assess you for risks, diagnosis, a lot of times, unless it's very complicated cases. They can also, if they feel that it's a good fit, then they will start medications for you.
I see. And that's usually covered under your care, primary care.
Yes.
And all right. And then they would refer you to someone if there's a need.
Yeah, so they usually, a lot of the doctors will have a list of therapists that might be on their referral base, and you have a list that at least you can start with, right? And also if you mentioned a lot of the therapists are out of pocket, but if one of the ways to do is to actually call up your insurance and be like, I need a therapist and this is my zip code. Then they will pull up a list of therapists under their insurance and send that over to you. Now, it does fall on you to call them, right? Each of them, and try to figure out if they are taking new patients, but that's a good start too.
Yeah. So check out Psychology Today website, and you'll send me the list of the two websites where people can go. So I put it in the description. Yeah, that's a great resource. What are some things that's important to look for when you're looking for a therapist?
Dun, 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 dun. That's a loaded question. I think it's, so it's like dating. Right? It's totally like dating in that you have to find the right fit. And you might not know what what fits you yet, right? So I do, I think I do too in my practice, but a lot of the therapists will offer kind of like a introductory call where you can kind of fill them out and see if you like them or not. You know, and you might have like a criteria, right? Like some people really want like a certain gender, certain ethnicity. To me, it's more what you don't want. Right. So I do have a lot of people who have like some, you know, specific sexual trauma who might not want a therapist of certain gender. Right. Or some people who have really difficult with English, or someone who wants to talk in their own language, or you know, like if someone who's like, well, I really want the virtual because available because my schedule is really difficult and sometimes I can't make it there, things like that. So it's about your own criteria first. I think also partially the two things that I think about in therapy is, well, number one is therapy is not like you get it and then done, right? It is a long-term investment. What it means is you're investing not only your effort, emotional effort, but you're investing your time and your money. And three of them are all equally important. So, you know, someone could be very good fit with me. You know, they like me. They really want to do it with me, but financially it's just not working out. Then we're not a good fit, because consistency and stability is important. If you're going to have to, you know, worry about finances every time you meet with me, that's not a good fit, right? Like we have to get those things out of the way first. So it's about also where that works and what your financial status is and what you can afford. So that's really important. Number two is you do have to feel comfortable, right? Some people, like I work with a lot of teens, so some teens like my style. I'm very casual. But also some teens don't like that. They want someone who's more authoritative, or someone who's more chamjana, right? Like something like that. And that's something that you have to think about for yourself. I also have some people who are like, I want someone older, right? Some older people feel very undermined, even if that's not the case, right? So all of these like dating fits are very important. And I always say shop around. The second thing that I warn people about looking for a therapist is that do not despair if the first one does not work. Right? They say that the average is about 3 until you actually, you know, make the right choice. And so, you know, even if you feel like it's a good fit and you try them, and then you're like, after like a couple times, you're like, don't be discouraged. You know, I think you don't just go to like one date. I mean, yes, some people would luck out, but you don't just go to one date and then marry them, right?
Right.
And so think of it as like, you know, it is an investment, because I do want to have someone who's going to be long term with me, and I can fall back on them. And so, you know, it's going to take courage and time. Yeah.
It sounds like you really have to be committed in getting this help, right? Yeah. Because, I mean, otherwise, why would you spend that energy and time? Why would you even go on the one date? Yeah, good point. So I was wondering, Dr. Cho, there are so many different types of mental health help, it seems like, out there. But as a patient or a client, I wouldn't know, like, who do I call? Do I call a counselor? Do I call a therapist? Do I call LPC, LMFT, psychiatrist, psychologist? Like, does it matter?
So yes and no. In general sense, it does not matter. Because, so yes, there are multiple degrees within the umbrella of therapy, right? Therapist. And they have all different kinds of training. And even with the same degree, sometimes the modality of the therapy that they use is different, right? But what is, to me, what is the role of therapist or psychiatrist or psychologist or, even primary care doctor? But you come to me and it's my job to figure out what you need and then figure out, am I able to give that or do I give you other resources? So it shouldn't fall on the patient to figure out exactly what do I need. Of course, if you can, that's great, but that's out of norm. Nobody knows, right? I've had I joke that I went to grade 33. So I've had a lot of training in this. And so it is my role to figure out what you need or what your child needs. You can go to the therapist and meet with them, and then the therapist can figure out, well, does this kid or person need a therapy? What kind of therapy does they need? Do they need meds? Maybe, maybe not. They don't decide on that. But if they feel that there's something that needed to be assessed, they'll refer. If you think that you have to find the right degree therapist or whatever from the get-go, that really heightens the barrier, and it's overwhelming.
It is overwhelming.
Yeah, just get to the one, and if they're trained well enough as a qualified person, they should be able to let you know.
I mean, I guess we don't decide as patients, but isn't it true if you need medication, let's say, the therapist, LMFTs and LPCs cannot prescribe medicine, correct?
So traditionally the medications can be done, medication assessment and prescription are done by psychiatrists, which are MD or DO physicians. And also these days in certain states, you can have psychiatric nurse practitioners that will do that. And so it's very, it is confusing. So basically therapists will not be able to do the medication, but they'll do the therapy. And it could be all, LMFTs, social workers, psychologists, right? Psychologists also have PsyDs and PhDs, but they're all doing therapy. And then nurse practitioners and psychiatrists are the medication management piece. And then not all psychiatrists and nurse practitioners will do the therapy component. Some people do. We get trained in it, but some people do the medication only and some people do both.
So your advice is just to go for one and see.
Yes, just get to that one person who is gonna be your point person in the beginning.
Yeah.
And if for the children, it could just be a school counselor, even, right? And then even the schools will have some names, and they'll be able to direct you as well.
Right. What about, this is on the side note, but what about ADHD assessment and, because a lot of people talk about ADHD these days. Where do you start with ADHD? You don't just get medicine, right? You have to go through assessment.
So yes, you do go through the assessment. There are multiple ways to do assessment. So one is through school. If they're actually having specific, very significant difficulties, then in public schools, American public school system, you can request to see if the kiddo needs an individualized educational plan assessment. And if the school deems that it is needed, then they'll do a part of that as well. A lot of the districts will have psychologists that will come and do the assessment if need to. And that is the long way, but also cheapest way.
Right. Yeah.
But also, ADHD is a clinical diagnosis in that like the pediatricians sometimes will be able to do the diagnosis and medication management. If not, then if you're very specifically wanting to know if there is an ADHD component or not, and the pediatrician says it's a difficult case, then you do need a child psychiatrist or neuropsychologist. So neuropsychologists are different because they are psychologists and they do testing. The neuropsych testing is not just for ADHD, but it could be autism, any learning disability, mood disorders, but it is very comprehensive. So I always say it takes like days, actually. Like you go in multiple times, they'll do an extensive interview with the parents as well. They do a lot of specific exams and tests, and then you come out with like 5 to 10 page report. That's not for everyone, but I think it is something that is very helpful for someone who's like really struggling. And then I am able to assess and diagnose ADHD, and all child psychiatrists are trained for that as well.
Is that something that as a parent that could decide, I want an assessment on my child, I think he has ADHD, or is that something that has,
Of course, yes. So I get phone calls, and it would be, so for me, for any kiddo, ADHD or not, or for depression, anxiety, whatever, I would meet with the parents for about an hour, get a very detailed history, and then I would talk to the kiddo, and then we talk about, so the whole process for me takes about 2 hours. And then the neuropsych testing is much more comprehensive and more testing based.
Okay. Do you only see patients like locally, or are you able to assess?
Yes. So my practice is a little bit unique in that my practice is virtual. So everything's virtual, and I span about 6 states. So I see patients that are living in, write them down, everyone. New York, New York, DC, Maryland, Virginia, state of Washington, and California.
Oh, cool. Nice. We'll list them in the description. Make sure to check it out.
That's right.
Oh, nice. Okay, that's helpful. I've been interviewing a lot of Korean Americans in mental health profession or industry, right? And I was so happy because I have a list of names where I could, refer people to. But one question that people have is, what about the confidentiality? These are people in the Korean or American community. We know each other from, what did they say? Like, 한 다리 건너면 다 알아, right? We know each other. It's a tight-knit community. What about the confidentiality? What would you say to that?
Well, I would say do not worry because we are legally bound. So confidentiality is basically ingrained in all therapists and all physicians in general, right? It is very federal law, basically. So whenever I talk to the patients, number one, in adult patients in general, I have obligation as a moral obligation and legal obligation to keep the confidentiality. And what goes into confidentiality is everything that we talk about in our session, unless you say that I can divulge those things, right? So this is a talk that I have with teens a lot because they're like, well, my parents, you talk to my parents and, what are you going to do? And so what I tell them is my patient is you and my confidentiality obligation is towards you. So parents are not my patient. So, for example, everything that we talk about is confidential unless you tell me that I'm okay to talk to them about. I can't. There And these topics include sexual orientation, gender identity, substance use, pregnancy, all of these things I cannot divulge at all. There are two things that, as a psychiatrist, I am obligated to divulge if you tell me. One is if you tell me that you're going to go kill yourself today, suicidality, right? Then I am obligated to do something and say something. The other one is homicidality. So if you're telling me that you're going to either go kill someone or hurt somebody today, then I am obligated. But outside of those two, I am unable to. Now, I just want to put a addition to that with teens, then I add, but if you are having any of those problems and you tell me that I can't talk to the parents, then we can talk for a long time and talk about why that is and why we should talk to the parents about it. Right? And so unless you say yes, I can't, but we will be talking about why that is and things like that. Now, in the adult system, even if I end up meeting you at H Mart, what we talk about is I'm not gonna say hi to you unless you say hi to me. I'm not gonna introduce myself to anybody unless you come and you want to do that, and I'm more than willing to do it. But I'm unless you initiate it, I'm a silent person. Right? Yeah.
So it should be the least of the worries. Confidentiality.
Yes. And it does not, all the medical records. I have a lot of parents who are like, well, is it going to be in the school? Like, what if they are applying for school, for college, for work? No.
Yeah, that's something that needs to be clearly understood because a lot of people wonder about that seriously. Like, really? But yeah, I guess, I don't know how that works in the Korean society, but it seems like a lot of people are worried about, it's going to go on my record, but it's going to interfere with my job search and getting into schools. No. Yeah. Okay. Well, that's good to know. You mentioned a little bit about it, but I think the cost of therapy really is one of the biggest barriers. I feel like maybe the perspective has to change how we look at therapy as something extra. I don't know. What can we do? How can we look at this?
Yeah, so unfortunately, I think, the structure of American medical insurance is in certain way, especially for mental health, that it is really difficult. So some therapists and psychiatrists do take insurance, and so if that's important, then I think that's when you go to your insurance, say, "Can you give me the list of the names?" And they'll give you names of people who are in network, and then you pay copay, and that's it. And so that's number one. In terms of if you do have the funds, but also it is quite a lump sum, then a lot of times, yes, you do have to think about your investment and what you want to get out of it. But also, people who are out of network per se, who don't take insurance. So yes, we do. Personally, I do keep credit cards on file and charge them. But what we do is we provide what's called super bill, and so super bill is kind of like a receipt. It will have certain informations the insurance companies are looking at, and then you can submit that to your insurance, and a lot of the insurances will reimburse portion of that. The way to figure out how to do that is you call up your insurance, and it's very important. The keywords are, what are my mental health out of network benefit? So that's a really key word because mental health is carved out of the medical health. So you have to say, what are my mental health out of network benefit? And they're able to say well, will you reimburse 70% or how much ever. So that's the keyword that you're looking for, to ask them what your specific plan is giving you. And so I have a lot of patients who will, before starting treatment, will go to them and ask about it and then see what their financial status is, right? So that's important. And then a lot of the therapists and psychiatrists will have what's called sliding scale. So if you just tell them, like, this is a little bit hefty, out of my range, but I really want to work with you. Is there a way to lower the cost? And that we can work out a sliding scale. Some therapist colleagues will take the income-based sliding scale for their patients. If it's something that's really difficult, like, some students or someone who is in a low-paying job, a lot of the mental health clinics in the cities will have kind of a training program where they, like I was in a program where I paid $10 a session to go for therapy while I was in residency and things like that. So there are definitely ways to do it, even if you don't feel like, I don't want people to feel like this is only for the wealthy.
I'm so glad that a lot of people are, I see this in my everyday, that a lot of people are open about getting therapy and the need. So that's a good thing. That's a good thing. But I do also see a lot of people stopping maybe in the third or fourth session because of, I don't know, the time and the money issue and everything else. I guess they don't feel like I see the difference right away, but it's a journey. It's a long process. It's not going to be 1, 2, 3.
Yeah. So in therapy, I mean, it depends on the modality, but I would have to say the shortest would be like, the modality that the cognitive behavioral therapy, like CBT, even is like at least, like 16 weeks, 12 weeks program, right? And so it is a long term. In terms of the therapy, I always tell my patients, we look at, how like you have report cards, we look at it as like every 6 months, not even, so maybe a year, right? And a lot of times people don't notice what's happening or what's getting better. And then we do like a section in 6 months and like, what are the things that let's go back to my notes from 6 months ago. Are these things happening? Are this is better? And people are like, oh yeah. So it's not like a drastic like transformation. It's very subtle, but also very, if you think back, groundbreaking.
Yeah. Takeaway today is, if you don't find joy or not stop noticing things, maybe it's time to say, is there something that I need to do? And start small. Maybe your family doctor or your primary care. Start there and see what works out. And it's like dating. You don't have to find the one with the first try. And also there are ways to get help financially. And it is important, a very important and essential part of our wellness these days. Yes. So thanks, Dr. Jang Cho, for your time and such insightful wisdom. And I'm so excited for this series. Hopefully many people will find it helpful, and click that subscribe button for me.